From WLWT, this is Issues.
Hello, welcome to Issues. I'm Jan-Michele Lemon Kearney of SESH Communications and the Cincinnati Herald. We have a lot of really good information, and for people like my husband who find medical stuff depressing, it's not depressing. Knowledge is power. Remember that, knowledge is power. So we're going to talk about new treatments or new help for people with heart failure. Also, we're going to do some musical stuff with the Cincinnati Black Theater Company. First, we're going to talk about peptic ulcers, sometimes called stomach ulcers, and I'd like to introduce my gastroenterologist, Dr. Ahmad Attar, who recently gave me a colonoscopy. So excited, it worked out fine. So welcome.
Thank you.
Thanks for coming on.
Thank you for having me. Thank you.
So this is a different topic. We haven't really talked about the whole peptic ulcer issue before and leading to stomach cancer, but what are the causes of peptic ulcers?
You know, peptic ulcer disease can happen for many reasons. Sometimes we do not know the reason. Some of the old theory, they have excessive acidity, or the infectious reason with bacteria is called Helicobacter pylori, and sometimes drugs
they call it
induce
H. pylori. I see that
abbreviation as H. pylori, and sometimes drugs can cause ulcers. And these two types of ulcer, either duodenal, which is in the duodenum, the first part, small bowel, or gastric ulcer. That's very common things that we see, you know, almost every day. And sometimes we do not know the reason for the ulcer, but most of the time we see either H. pylori or excessive acidity, or the drug as anti-inflammatory medications such as ibuprofen, Aleve.
Oh, and that's really common.
It is very common. We see that all the time, Jane. Yes.
And I was going to say with this H. pylori, and I hope I'm saying it correctly, so, and I was just telling you, I read where 2/3 of the world population actually has this bacteria, but we don't know it. There are no symptoms.
There is no symptom for H. pylori unless we see symptom resulted from the H. pylori presence in the stomach. So H. pylori is a bacteria that can cause gastric ulcer, duodenal ulcer, gastric carcinoma, and lymphoma. And if we do not find the H. pylori, and it would be very much hard to know what the patient has. The majority of people with ulcer, they have H. pylori with it. Up to 99% of duodenal ulcer have H. pylori, and about 80% of gastric ulcer. If we do not treat H. pylori and eliminate it, we surely subject the patient to risk having lymphoma or adenocarcinoma of the stomach, which is a cancer. Yes.
Stomach cancer, yeah.
Yes, stomach cancer. So treatment for H. pylori is mandatory when we find it. We have treatment that effective up to 95% of the time.
Oh, okay. Well, that's good. That's encouraging.
It is very encouraging, indeed. Yes, indeed.
Well, you know, so looking for symptoms, because, you know, people, I mean, we can't self-diagnose, but, you know, we do want to be on the lookout. What are some things we need to look for? Well,
symptoms of H. pylori sometimes have no symptoms. Occasionally, very minor symptoms such as nausea, vomiting, or abdominal discomfort. Unless H. pylori causes cancer, and obviously the symptom of cancer, or cause also the symptom of ulcer. The ulcer can cause nausea, vomiting, abdominal pain, and sometimes patients come in with really complications of the ulcer. We do the endoscopy, we diagnose the ulcer, we take biopsy, we find H. pylori, and we know that is the cause for the ulcer. If we treat the ulcer without eliminating the H. pylori, it will always come back. And sometimes H. pylori can be there without causing any ulcer. At some point in the future, they may develop cancer or lymphoma, which is kind of cancer.
Well, in addition to the H. pylori, you mentioned acidity. So does that have to do with you know, our diet, or is that just, you know, what is that?
Well, that's an interesting point. Really, acidity has been thought for years and years to be the cause for the ulcer. And if we do not block the acidity, the ulcer will not heal. So it certainly is a factor in developing an ulcer. Diet per se will not cause ulcer. But that is important. If someone has already an ulcer, they need to watch what they eat, you know, in the most of the time.
So what kind of foods should they stay away from, or should they eat?
Well, during the acute stage with ulcer, we recommend to be in a soft diet. And then as the ulcer heals, they can advance it to a regular diet. You know, we recommend avoid alcohol, carbonated beverage, excessive caffeine.
So soda pop and coffee.
That's a no-no, absolutely.
Okay,
yes,
a no-no for soda pop,
right.
okay.
So as alcohol, of course, that should be avoided during the acute stage of the ulcer.
Okay.
Correct.
Now we've got some photos, and they're kind of in different orders, so you'll just have to go through and explain them one by one. But let's just start with this one. What are we looking at?
This picture is adenocarcinoma of the stomach that we see with H. pylori. That's how the cancer looked like in there.
So that's after it's already caused the cancer.
It's the growth in the stomach that caused by the H. pylori, correct. This is how ulcer looked like in endoscopy, is that the white spot in there, the ulcer has actually gone through the wall, and that's how it appears in endoscopy.
So an ulcer is kind of like a sore inside your stomach.
It is a sore, exactly.
Yeah.
It is indeed a sore inside the stomach, right?
Yeah.
And this is a picture of lymphoma inside the stomach, that also from the H. pylori. Lymphoma is a form of cancer. It can happen in the GI tract. We have lymph tissue throughout the whole GI tract, and cancer can happen. This is a picture of ulcer that's bleeding. Oh. And you see how the blood coming out in there. This is a bleeding ulcer, which is complication of peptic ulcer that's not treated, undiagnosed.
So now, would you see the blood in the urine, or yeah?
No, you see blood, you mean the vomit blood. You see blood with the stool.
Oh, okay.
Indeed, right, which is really a complication. Could be life-threatening unless diagnosed and treated properly right away.
Oh.
The other picture is another picture of lymphoma here that involved the upper GI tract from H. pylori that also can cause lymphoma. Again, lymphoma is a form of cancer. This is a picture of an ulcer in the stomach. That's how ulcer look like in acute stage. That's seen in endoscopy. Again, it's a sore spot. There's bleeding. You see that blood around the ulcer. That happen from bleeding. As the ulcer penetrates through the wall, it may hit the vessel, and that will cause a bleeding, yes. Okay,
now Dr. Attar, I'd like to make sure that our viewers have your phone number, your office number, and I have 513-791-8882.
Correct, yeah.
Okay,
correct.
And I'll say it one more time, 513-791-8882, and Jeff has it up there. And that's the office of Dr. Ahmad Attar, and you're with Mercy Health and Tri-Health.
Correct.
So yes, and actually Dr. Keith Melvin introduced us to you, and we were so excited. So because we enjoy having you on as a guest, you really explain things so clearly, and we don't want folks to be afraid of this, but to be knowledgeable.
Exactly.
So that's the key.
Also, it's treatable, recoverable. It's really, if it's caught early, diagnosed early, it can heal.
And that's the key. All right, thank you so much. Appreciate it.
Thank you so much, Jan.
Stick with us. We'll be back in a moment. Timikal Bobo is going to talk with some UC Health physicians. Stick with us.
I'm Timikal Bobo. I'm here with Dr. Lewis B. Lewis IV, UC Health's Chief of Cardiac Surgery, and Dr. Feldman, UC Health Director, Clinical Services of Heart, Lung, and Vascular Institute. So, doctors, tell us a little bit about your positions at UC Health.
So I'm the Chief of Cardiac Surgery. I'm a heart surgeon. I deal with open heart surgery. I operate on adults with coronary artery disease, adults with heart failure. I'm a transplant physician, and I lead the transplant and artificial heart program at the University of Cincinnati.
Great. And Dr. Feldman?
Michael, it's my responsibility to oversee the cardiovascular service line, which means that as an invasive cardiologist, my daily job is related to the management of end-stage heart patients, critical care patients. And Dr. Lewis and I work together on a daily basis with taking care of very ill patients, end-stage patients.
Okay. So we're here to discuss a little bit about patients with heart failure and a device you have that is CardioMEMS system. It's a system for monitoring heart failure. Give us a little information about what this is.
So, Michael, we have roughly over 5 million people in the United States who are suffering from heart failure, which has a diagnosis which is more lethal than the overwhelming majority of our cancers, HIV or diabetes. It's not that those diseases are not very important, it's that people underestimate how sick these patients are, and the patients underestimate it. So we needed a way to actually make a determination when these patients were getting sicker objectively, not based on how they felt. And so roughly 1.5 million of these patients have advanced disease defined as class 3 or 4 heart failure, okay? 1 and 2 is less sick. And this device was designed to go into the pulmonary artery, which is the vessels that go from the right side of the heart to the lungs, to actually monitor all the time for the lifetime of the patient their hemodynamics or their intracardiac filling pressures. And this gives us very objective data about how well or how sick they are.
Okay, and have any patients been implanted with this device?
Yes, ma'am. There had been 2 errors because there was a trial called the Champion trial where this went through and it was under clinical investigation and we were making a determination whether it had been done. And I personally was involved in over 25 cases at that time. Since it's been approved by the FDA and it was subsequently commercialized through St. Jude, it has been rolled out again, and there have been over 8 patients enrolled just in the last couple of months at UC Health.
Okay, and when is this used? What will it accomplish for the patients once you all complete some of the research? Where would this lead us to in the future?
So as Cincinnati's only academic medical center, we really use this device in our armamentarium to move the whole field of heart failure forward. So it's not just monitoring the outpatient, the patient as an outpatient with heart failure. We use that and we watch as the patient becomes sicker. We make a determination when it's time to place this patient on an artificial heart. And then we can study the device while the patient's on a artificial heart and eventually move that patient through to heart transplantation. So at the University of Cincinnati, we really have the ability to provide the service from the day you walk in with the new diagnosis of heart failure, which is a very serious diagnosis, to the day that heart disease either gets better or progresses to the eventuality of being able to have that apex therapy, the ability to transplant someone else's heart. And we provide all those services at the University of Cincinnati. The CardioMEMS device is just one arrow in that therapeutic quiver of devices that we have to treat this.
And Timikal, the research that you were talking about is actually coming to completion and fruition now. So over 5 years, maybe over 7 years of actual scientific work has gone into now that the first publications are being submitted, and UC Health is actually leading not the region but the nation and the world with these publications after the original publication that was published in Lancet many years ago now.
Okay, and who wrote this publication?
It was written by me, actually, okay, along with several other very excellent authors.
Okay, and what advice would you give for someone that might be experiencing heart failure or any heart conditions? Is there anything they can do to prevent this?
So heart failure is a very grave diagnosis. As Dr. Feldman said, having the diagnosis of advanced heart failure has a worse prognosis than most cancers. So the importance is to seek treatment early and to seek treatment early and to follow up with it, and to follow really with an advanced heart failure specialist to treat this. We talk about preventing disease, but really the disease that Dr. Feldman and I deal with is once you have that disease, it's a bad problem. But there are really good solutions for the bad problem that these patients have. Okay,
how can people reach you? Do you have a phone number and information?
So the easiest way to access the advanced heart failure clinic at the university is to have your doctor make a referral or make an appointment yourself at UC's Advanced Heart Failure Clinic.
Okay, and we do have a phone number which is 513-584-7217. That's the UC Health Cardiovascular Department at 513-584-7217. Thank you both for being here with us today. I believe that we now have more information about the CardioMEMS system, and we will move forward with the research and the great research you're doing. Thank you. We'll be right back.
Thank you, ma'am.
Welcome back. Okay, next time we have Dr. Lewis and Dr. Feldman on, we're going to have Dr. Lewis talk about how football changed his life, and we're going to let Dr. Feldman give you tips because he is a football coach. So we've got a lot to talk about with them. Now we're going to switch gears. We're going to talk about a musical, The Wiz, and it's coming up by the Cincinnati Black Theater Company. We have two of the actors in it, and so excited to have them here. Shermaine, Culbreth, welcome, and Lamont Hill. Yes. So you play Dorothy, you're the big star, and you're a star as well. You play the Scarecrow.
Yes, ma'am.
How did you guys get involved with theater?
Well, for me, it started a long time ago when I was a little girl. My grandmother was into theater, and I remember sitting out in the audience. I used to have all of her lines memorized.
Really?
And so I would kind of be acting with her in the audience. And so when I got to high school, I decided to step out on my own, and that's where I was inspired first.
Wow. Lamont, what about you?
Pretty much the same thing. I started in elementary school, and then just started to develop my love for it and started writing my own things.
Oh, really?
Yeah.
Oh, you're a writer too?
I'm a writer as well, yes, ma'am.
Wow.
So yeah, just been doing it ever since.
And how long have you all been involved with the Cincinnati Black Theater Company?
This is my first year.
Oh, is it? Okay. How
And
about
this
you,
is
Lamont?
my 2 years. For me.
Okay.
Yeah.
Because, you know, Don Sherman is just phenomenal. He's
great.
very professional. I remember when my daughter was in a play years ago, and I was really impressed with him. I mean, he expects a lot. It's not, you know, I mean, it's for fun, but it's not, you know, he's not playing around. It's really very professional.
I really appreciate what he does for the community. He gives people an opportunity in theater that may never have an opportunity. So, and then he pushes you, and he expects excellence, and he really just drives that home. So
he's fantastic.
Yeah,
Well, tell us the story of The Wiz.
Well, The Wiz is an awesome artistic rendition, soulful rendition of The Wonderful Wizard of Oz.
Right.
Everybody's fallen in love with it, but it's just pretty much about Dorothy, this young girl. She's not quite comfortable where she is, and she's you know, she doesn't really appreciate home and her family, and or even, you know, what she has in herself. And so she goes on this awesome magical journey where she meets these awesome people, and
like the Scarecrow.
Right, like the Scarecrow and the Tin Man and the Lion, and she learns to be confident within herself, and she learns what, you know, precious jewels she has at home and with her family. And so it's just an awesome story.
And I was going to say, so you're following in the footsteps of Dorothy's, like Stephanie Mills, and Diana Ross was Dorothy in the movie,
Right.
wasn't she, with Michael Jackson? And, yeah, and I think everybody saw that growing up when they were little. So, we've got pictures. Tell us about that. I didn't realize we had photos. Okay, thanks, Jeff. Go ahead. Tell us about that, Lamont and Shermaine.
Oh yeah, well, that was our first look at our first costume try-on.
So there you are, there's Shermaine.
Yeah,
now, who's that playing the lion over there?
His name is Jazz. We call him Jazz. I can't remember his last name.
Okay, Jazz.
It's a big long name, but Jazz for short.
Jazz. Okay.
He's awesome though.
All right, that's great. And so let's see, are there any other photos coming up? And maybe not. Okay. All right, so that was a nice. So that's when you guys first got your costumes.
Yes.
First. Okay, and I want to let people know when it is. So The Wiz is playing September 30th, October 1st, and October 2nd at the Mount St. Joseph Theater. Give us all this information. Either one.
September 30th is a Friday night. That show starts at 7:30 p.m. October 1st, Saturday, we have a 2 o'clock show and a 7:30 p.m. show, and then Sunday, October 2nd, there is a 4 o'clock show.
Okay, and it's at Mount St. Joseph.
And it's because of Mount St. Joseph, the University Theater, 5701 Delhi Road. And for more information,
number,
you can call 513-241-6060.
Okay, 513-241-6060. And I know that the Cincinnati Black Theater Company often has group ticket sales as well.
Yes.
So when people call that 241-6060, they want to check on group sales.
Absolutely.
But I was going to say, all the Cincinnati Black Theater productions are just so phenomenal and so professional. And I know The Wiz is going to be really great.
We're excited.
So now did both of you choose your parts? I mean, is
we
the Scarecrow the part you actually auditioned for?
It is the part I auditioned for,
So you wanted that part?
I wanted the Scarecrow, yeah.
Okay, and then Dorothy, you want it?
Same for me.
Yeah. So how's it going with the whole musical part?
I think it's really going well. We have some very talented people who are singing, and they'll sing you under the house.
Okay.
So I'm really excited about everybody being able to hear them.
Well, you know, we're going to give our audience, as we go out, we're going to let them, you know, hear a little bit. Now you're going to sing the song Home. and it's home about Dorothy wanting to go back home.
Yep, this is at the end of the show, and she's just really talking about what she's experienced and how she does want to go home.
Oh, so this is the grand finale number. Oh my goodness. Okay, so we're gonna, as we leave, we're gonna let people hear just a little bit. We can't give them the whole thing, Shermaine. We're just gonna let them hear a little bit. But I want to remind people again that the Wiz is September 30th, October 1st, October 2nd at the Mount St. Joseph University Theater, 5701 Delhi Road, and people can call that 513-241-6060 phone number. We don't want folks to miss it. It's just so great, and it's for the whole family.
Absolutely.
It's for the whole family. Okay, so all right, so we're going to let Shermaine Culbreth, and before you start, let me ask you: Are you also singing in,
I am also
okay,
singing.
so everybody gets to sing.
Yeah.
Okay, so the next time we'll have to have you sing as well, Ahmad. Okay.
Sure.
All right, so we're going to have Shermaine sing a little bit of Home as we go out. Stick with us.
I missed it. I missed it. I missed the cue. I missed the cue. Can we start it over?
Okay, hopefully you heard a few bars of Shermaine Culbreth singing. Her voice is just so beautiful. Don't miss the Wiz, September 30th, October 1st, and October 2nd. And now we have Timikal Bobo, who's going to tell you about some more events.
We have up first, Fall 2016 Parent Academy, the parent sessions for starting October 3rd. It's a free program including free transportation, free childcare, and free meals. The phone number for more information is 861-5323. These parent sessions will be happening in Avondale, Bond Hill, Carthage, College Hill, East Walnut Hills, Price Hill, and the West End. Next we have Dada Rafiki, I See You Sister. Friday, October 14th, 7 p.m. at the Aronoff Center's Jarson Kaplan Theater. Tickets in advance are $22.25. At the door, $32.25. For more information, call 621-2787 or 821-9027.
Fantastic, that's great. So that was really good. So Dada Rafiki, you know that's Annie Ruth, you don't want to miss her, and the Parent Academy, Dr. Carolyn Turner, Dr. Pat White with Leadership Scholars. So we want you to have a great week, stay safe, and stay positive.